Never miss another question on the sciatic nerve again. 3 steps. 1, posterior hip dislocation must be confirmed by your clinical presentation, right? So you're gonna have a lower extremity that's like adducted and internally rotated weird. Just know it could be like shorter than the contralateral leg. Just know these findings are posterior hip dislocation. 2, where's the sciatic nerve? You have to know where it is. It is, and the way to know this is, or the way to remember this is, the sciatic nerve runs posterior to the hip joint and is at significant risk of injury during a posterior hip dislocation. That's pretty much all you need to know. And then 3, you have to just differentiate it between other spots like the femoral artery, femoral nerve. Those are associated with hip injuries, yes, but they're primarily at risk during anterior dislocations. Posterior, sciatic. All right, and then in contrast, last one you need to know, and you'll never miss another question on this, lateral femoral cutaneous nerve and the superior gluteal artery are not at risk in scenarios where you have posterior hip dislocations, and so it's going to be sciatic. All right, that's pretty much all there is to know. So now let's dive into a question if you feel confident. 29-year-old woman to the ER after a motor vehicle accident. Her right leg is shortened. Oh no, we already know what it is then. X-ray confirms posterior hip dislocation. Boom, another big thing. What is most likely injured? Sciatic nerve. Look at that. We cast 3 nets and then it caught 2 of them. That's how we do this. That's how we ace this test. A, B, femoral artery that's going to run anterior to the hip, more likely injured in anterior problems. Lateral, compressed during inguinal. And superior is going to be a risk in pelvic fractures. If this is helpful, then like and subscribe. We'll see you guys in the next video. If you guys like free education, we're going to be building some awesome platforms. So please show your support by liking and subscribing if you think this content's helpful. Peace out.